Coronavirus news is coming fast and furious as the Delta variant fuels another surge in cases across the United States. Arkansas set a record for hospitalizations, while officials in one Florida county are urging residents to consider other options before calling 911. Health officials in Mississippi said the state's hospital system could collapse in 5 to 10 days if the current trajectory continues. Current vaccines protect against severe disease, hospitalization and death, and institutions across the country are strengthening their vaccine requirements and guidance. For instance, the Centers for Disease Control and Prevention is now strongly urging all pregnant people get vaccinated. The Food and Drug Administration could decide this week whether to extend its emergency use authorization to booster shots for immunocompromised people, a move that Dr. Anthony Fauci described to NPR's Morning Edition as imminent. More places are now requiring vaccinations, or penalizing people who don't get the shot. The Defense Department is moving to require vaccines for service members, and the Department of Health and Human Services is ordering them for its thousands of healthcare workers. Plus, some small colleges say they will charge unvaccinated students an extra fee. With different rules and regulations in place in every state, the fight to control COVID-19 looks a little different depending on where you live. You can find a state-by-state breakdown on the latest case numbers and vaccination rates here. California just became the first state to require all teachers and staff in K-12 public and private schools get vaccinated or undergo weekly coronavirus testing. As KQED's Julia McEvoy reported on Morning Edition, the move affects some 300,000 teachers and tens of thousands of school staff such as bus drivers and custodians. Governor Gavin Newsom said the move is intended to reassure parents and motivate people to get vaccinated. Schools have until October 15 to show that all employees are immunized or begin regular testing. Officials in Brevard County, on Florida's east coast, are urging residents to consider other options before taxing ambulance services with non-emergency calls and showing up at the ER for a COVID test when other test sites are available, according to its Emergency Management Office. All three of the county's hospital systems are already over capacity and have had to implement surge plans that involve canceling elective procedures and converting regular rooms into COVID-19 spaces, said Brevard County Emergency Director John Scott. He noted that hospital emergency rooms are seeing comparable surges in patients with COVID-19 symptoms who are not necessarily experiencing emergencies, which puts other patients, such as those seeking care after accidents or heart attacks, in danger.